Hello, my name is Beth Price and I'm one of the clinical nurse educators in the intensive care unit at the Royal Darwin Hospital. The aim of this short presentation is to introduce the multidisciplinary team to the proning technique we use here at the Royal Darwin Hospital Intensive Care Unit and to summarise acute respiratory distress syndrome, otherwise known as ARDS, which is the main disease process where proning may be considered as a treatment option. The presentation is aimed at both nursing and medical staff and will consist of a short PowerPoint presentation on ARDS, followed by a 4-minute video on the proning procedure we use at the Royal Darwin Intensive Care Unit. The main learning objectives for this session are to anticipate when an intensive care patient may need proning, to be able to outline the steps involved in patient proning, and lastly, to be able to demonstrate the proning procedure in a simulated environment on completion of this session. And we will be running simulations on proning techniques over the next few months. So the first question we want to ask then is, what is acute respiratory distress syndrome? So some of you will have come across the term ARDS during your time in intensive care. But just to recap, it's an inflammatory lung condition involving both lungs that may complicate severe pneumonia, trauma, sepsis and many other conditions. Inflammation leads to injury of the lung tissue, which culminates in leakage of blood and plasma into the air spaces, resulting in low oxygen levels in the blood. So what are the clinical features of ARDS? Well, think back to some of the patients you have been exposed to during your time in intensive care. Have they exhibited any of the following features? So bilateral lung opacities consistent with pulmonary edema from a non-cardiac origin, along with a moderate to severe impairment of oxygenation as defined by the PaFiO2 ratio. Now the Berlin definition of ARDS will explain these features in more detail, and I'll leave the reference for that at the end of the video. So can we treat ARDS? Well, the management of ARDS revolves around treating and stabilising the underlying cause of the disease, and this includes intelligent use of sedatives, hemodynamic management, nutritional support, control of blood sugar levels, and deep vein thrombosis and gastrointestinal prophylaxis. So what about proning? Well, we usually mechanically ventilate our patients in the supine position. Prone ventilation is ventilation that is delivered with the patient lying in the prone position. Proning does alter the mechanics and physiology of gas exchange and can improve lung perfusion. Now, proning in this particular intensive care is a rare event. This may be due to trials involving patients with ARDS failing to show a beneficial effect of prone positioning during mechanical ventilation. However, the PROCEIVA study was published in 2013, which concluded that patients with severe ARDS who undergo early application of prolonged prone positioning had significantly decreased 28-day and 90-day mortality. It is beyond the scope of this video, unfortunately, to discuss the paper further, but I will also leave this reference at the end of the video. Now that we have highlighted the type of patient that may benefit from prone positioning, it's time to watch a short 5-minute video on proning. The video demonstrates the proning procedure only and has been designed to complement the proning protocol that can be found on the PGC. As such, please ensure that pre-proning care, such as eye and mouth care and line positioning, have been undertaken prior to the procedure. Firstly, gather your team of at least 7 people and the equipment you will require. These will include 3 pillows, ECG dots, Mepitel to protect the patient's eyes, a slide sheet and 2 bed sheets. To position the patient in the middle of the bed, supine, with the top of the head close to the top of the end of the mattress. Place your patient's arms in line with your patient's body with hands tucked in against the thighs. Next, place the disposable proning pillow onto your patient's face, ensuring ET tube stability. You will now need to place your 3 pillows onto your patient, one on the patient's chest, one on their hips, and one on their shins. Now place 2 bed sheets over the patient's body, avoiding folds and creases. Then place the slide sheet over the bed sheets. Now take the ends of the sheets that are underneath the patient and roll together with the top sheets and slide sheet. You are now aiming for a sausage roll effect. While holding the slide to the roll, move the patient towards one side of the bed. This will depend on tubing and invasive lines, and usually the team leader will decide on the direction of the manoeuvre. Then turn your patient to a 90-degree angle onto their side whilst maintaining the integrity of the roll. Now turn your patient another 90 degrees so the patient ends up in the prone position. Position the patient in the centre of the bed with the top of the patient's head close to the top of the mattress. Then unwrap the sausage roll and remove the bed sheet from the top of the patient. Then recheck all tubing, invasive lines and drains for patency, security and accessibility. Ensure limbs are in an anatomical and comfortable position, usually with one arm up and one arm down. Then carry on all nursing and medical management as per protocol. So that brings us to the end of this presentation on ARDS and proning. I hope you feel you've achieved the learning outcomes for this session, which were to anticipate when a mechanically ventilated patient may need proning, to be able to outline the steps in patient proning, and to demonstrate the proning procedure in a simulated environment on completion of this session. The Education Department will be running simulations regularly where you can come and consolidate the knowledge that you have gained in this PowerPoint presentation and video into a simulated environment and then eventually into the clinical environment. I have left a list of references for further self-directed learning after this slide. And if you require any further information regarding ARDS or the proning procedure in this intensive care, please come and see me or contact me at bethan.price@nt.gov.au. Thanks very much for listening and goodbye.